Welcome to the Better2Know Instant Test training video series developed in partnership with the Center of Excellence for Sexual Health. This video will focus on an individual instant test in a number of sections, from what is included in the kit to using it to test for infection, interpreting the results, and completing the test process. You can also find the information included in this video in one of our quick reference guides, which should be provided to you along with your first delivery of our instant test kits. Our aim in presenting this video is to provide you with all the information you need in order to successfully run and deliver one of our instant tests. There are a number of safety procedures to be followed in order to ensure the test can be carried out. These include storing the kit safely within a temperature of 2 to 30 degrees Celsius, not using the kit if it is not sealed, has been punctured, or has been tampered with, preparing a clean and clear area on which to run the tests, wearing suitable examination gloves and clothing, disposing of all materials in a suitable biohazard waste container, and treating all biological samples as potentially infectious. The Better2Know Instant Syphilis Test Kit includes all the contents required to deliver 10 or 20 individual tests. The kit contains a diagram and instructions for use on the inside of the lid, a detailed instructions manual, 10 or 20 test cassettes in individual foil pouches, 1 vial of buffer, 10 or 20 EDTA capillary tubes, a bag of 10 or 20 lancets for sample collection, 10 or 20 alcohol wipes, and 10 or 20 adhesive dressings. Instruct the patient to wash their hands in warm, soapy water. Then sit them down and choose the middle or ring finger on their non-dominant hand to provide the sample. Clean the selected fingertip with an alcohol wipe and allow it to air dry. Place the lancet off-center on the fingertip. Press the lancet firmly against the finger and puncture the skin. Wipe away the first drop of blood with a cotton ball. Use a capillary tube to collect the blood sample. Fill the tube by holding it horizontally against the puncture, drawing the blood out by gently squeezing the finger. Try to avoid letting any air bubbles form inside the tube. Alternatively, the patient can directly drop the sample into the well of the test cassette. Remove the test cassette from its pouch and place flat onto a clean and clear surface. Add 2 drops, approximately 100 microliters, of blood sample into the sample well of the cassette. Then add 1 drop of buffer. Read the results 10 minutes after the addition of the sample. Please do not interpret the results longer than 30 minutes. To read the test results, a control line should appear in the area marked with a C on the cassette. This indicates the test has run successfully and should appear in the event of either a reactive or non-reactive test. If the control line does not appear, the test has not been successful. In this event, the test should be repeated using a new cassette and sample. In the event of a reactive result to the test, this will be shown by both a line in the control area and a line in the test area on the test cassette. These lines will appear next to the letters C and T. The shade or color of the test lines may vary, but the result should be considered reactive even if one of the lines is faint or a slightly different color. If the test result is negative, this will be shown by a control line only. Results must then be told to the patient. This should be done verbally in a calm and prompt manner. The patient should be reminded that they may contact Better2Know if they need any further assistance. The Better2Know Instant Test Results Report, which is attached to the patient's booking confirmation email, should be completed. A copy should be handed to the patient. In the event of a reactive test result for either HIV, hepatitis B, hepatitis C, or syphilis, a venous blood sample must be taken from the patient in a gold-top vacutainer. Please inform Better2Know, who will then send you a new pathology request form. This new form and the sample should then be sent to the laboratory for confirmatory testing. The instant test procedure has then been delivered. This video has provided you with the information you need in order to successfully deliver one of our instant tests. In the case of any further questions, please contact Better2Know using the details on screen. Thank you for taking the time to watch our instant test training video.